Thanks, Joseph. Welcome, everybody. Thank you for coming. It really is, we really do appreciate you guys a lot, and this really takes a lot of trust to put your life, your limbs in our hands, so we really appreciate the trust that you guys given us when choosing us to be your healthcare providers. So my name is Dr. Eric Owashi. I grew up in Southern California, in Walnut, California, which is by Diamond Bar, West Covina, Pomona area. I did my undergrad at UC San Diego, where I got a double major in biology and psychology. I got my medical degree in Detroit at Wayne State, and then followed by orthopedic surgery residency at New York Medical College in Valhalla, and finally finished up my training in Scripps in San Diego, where I did my fellowship in hip and knee reconstruction, primarily for hip and knee arthritis. So I was asked today to talk to you about knee arthritis in particular. So we're going to go everything about what arthritis is and the different treatment options for knee arthritis. So arthritis is damage to your articular cartilage on the ends of our bones and our joints. The specific type of cartilage that Dr. Sherfi and Dr. Antelope talked about is a specific type of cartilage that you have on the ends of your bones to be a lubricant between the bones to allow the bones to move smoothly without it hurting. Now arthritis is damage to that type of cartilage, and there's different types of arthritis. There's autoimmune arthritis, such as rheumatoid or psoriasis or lupus, where you have your own immune cells that attack that specific cartilage in our joints. There's post-traumatic arthritis, where you have an accident like a fracture, an ACL tear, a meniscus tear that leads to faster progression of arthritis as well. Or there's your regular general osteoarthritis, which is the wear and tear disease of your cartilage, and which is the most common form of arthritis that you get just pretty much by living life. Walking, going up and down stairs, getting up from chairs. Unfortunately, every day as you're doing stuff and doing the things you need to do, you're scuffing up the cartilage a little bit more and a little bit more. That's why it's the wear and tear disease of your joints. Now, as you're all aware, or most of you are aware, the problem with arthritis is that there's no real medication to cure cartilage damage. It just doesn't exist. So unfortunately, when people start having pain from knee arthritis, that pain becomes permanent. And it gets worse and worse over time as you continue to walk and do your normal daily routines. So eventually, people start off having pain with arthritis in the knee just by walking every now and then. It starts to hurt randomly. Then it begins to hurt every time you go for a long walk. Then it becomes stiff when you're sitting down and you try to get up. Then it becomes painful when you go up and down the stairs. You're going to have to go one step at a time type of thing. Eventually, people will start using a cane. Then they move to a walker. If you don't do anything about it, you end up in a wheelchair. That's how bad it progresses. So the next question is, what do you do about it? Because no one wants to be in a wheelchair. So the first thing that patients do is they typically modify the behavior. They just don't do that activity that's causing that much pain. So you stop doing the things you love. You stop going on long walks. You stop going on hikes. You stop dancing. And it really affects your quality of life. Another thing that people have to do is they start taking frequent pain medication, like anti-inflammatories, like Tylenol, Motrin, ibuprofen, meloxicam, Celebrex. And all these things are very helpful, but it gets to a point where as the arthritis is getting worse and the pain is getting worse, they don't do a good enough job. So then people have to start taking opioid pain medication, like Tramadol, Vicodin, oxycodone, and all these things have terrible, terrible effects in your overall health and are a big problem in our current society. So eventually it gets to the point where those pain medications don't help either. And a lot of the time, that's when you come see us in our office, because everyone's kind of exhausted all the conservative treatment measurements. So, just so you're all aware, when you come see us at AVORS, our goal for each step of your treatment, each process, is to keep you functional. Keep you being able to do everything you want to do and love to do in life in regards to your knee. So the tools that we have to do this for your treatment is, one, we start you off on the cortisone injections, like Dr. Sherfi talked about. Now the cortisone is a strong corticosteroid that's an anti-inflammatory pain medication that will remove all the inflammation, which means removing all the pain in the knee. So you have a pain-free knee after the injection, which is my expectation. Now typically the effects take away all the pain for somewhere between 2 to 4 months. If these injections help you for at least 3 months, then they can be repeated and used as a tool to delay the need for your definitive treatment, which eventually is knee replacement. But I've seen some people get complete pain relief for 3, 6 months, sometimes even over a year. But unfortunately, as you continue to walk on your knee, the arthritis is still getting worse. So over time, the duration of effect of each of these injections tends to get shorter and shorter. When it doesn't help you for 3 months' time, we tend to move you to the next round of injections, which is viscosupplementation or hyaluronic acid injections. Those are a series of injections where you inject a thicker lubricating jelly inside the knee. Because remember, the cartilage is supposed to be a lubricant. By replacing the function of the cartilage with these gel injections, these gel shots can also take the pain away and be used as a tool to delay the need for your knee replacement surgery. But eventually these won't work as well. And you can also entertain the idea of doing PRP or stem cell therapy to try to delay your surgery further. But again, none of the injections really cure your cartilage as a definitive treatment. The only long-term solution there is for bad knee arthritis is with knee replacement surgery. Because again, there's no medication to cure that cartilage damage. Okay, and so what we do for knee replacement surgery is everyone thinks that all we're doing is we're taking your knee, chopping off the end of the bone, and sticking a big old hunk of metal in there, and that's your knee. That is not what happens. So what we actually do, it's kind of hard to stand, but what we actually do is we're removing just the surface of the bones. So this is kind of how we cut the bone. We're just removing the surface off the end of the femur and off the top of the tibia. So after we do the cuts and after we do the surgery, it's impossible to have arthritis afterwards because we're removing all the cartilage. After all the cartilage is removed, we put this metal cap on the end of the femur, this metal cap on the end of the tibia, and this piece of plastic in between the two is your new cartilage. We also remove the cartilage off the bottom of the kneecap and put this plastic button here. So after we sew you back up together, this is how it works. Your kneecap will slide up and down the metal component on your femur. Okay? The whole surgery only takes about an hour. You're up and walking on that knee with your full weight the same day of surgery, and most people go home the same day. You typically do physical therapy at home for 2 to 3 weeks. And you do physical therapy at an outpatient facility for 2 months. What I expect is after about 1 month, you should be walking fairly normally again, which means no pain medication, no walker, no cane. By 3 months' time, you should be back to doing everything you want to do in life without any severe knee pain. Now, the difficult thing about knee replacement surgery is the recovery process. Because in order to have a good result after knee replacement surgery, you have to regain your full range of motion of the knee, which means bending it all the way back here to 120 and getting it completely straight. And you have to stretch the hell out of that knee as hard as you can every day, multiple times a day, beyond the point of pain. So when my patients see me in the office, you tell I do not have sympathy. I push you to keep stretching the hell out of that knee, because you only have 8 weeks to get your knee back to 120. By 8 weeks, that scar tissue sets in. And then whatever motion you have when that sets in is the motion you have the rest of your life. If you're only able to bend it to 90, you will have permanent pain and disability because your knee's too stiff. That's why I really try to push my patients to really push themselves to avoid having that problem. But if you do your stretches well and you regain your range of motion, it's an incredibly beneficial procedure. Over 80 to 85% of patients that receive the surgery have a completely good outcome and are very satisfied with the outcome of their knee. And we're happy doing everything you want to do in life without any knee pain. It's 85%. So, other things that we talked about, innovations in technology, just like the robot. There's also a real big application for knee replacements as well. And here at AVORS, we're going to bring the robot to the Antelope Valley. So we're going to start doing robotic knee replacements, either at Palmdale, Antelope Valley, or Advocacy Surgery Center. Personally, I've already been fellowship trained in the robot, and the big benefit the robot has is there's two. One is that the robotic arm, you can pre-program and control exactly where that saw is going. It cannot cut any dangerous structures and is a much more precise cut than doing it with your hands. Also, the robot is very intuitive because you're able to balance out the soft tissues of your knee prior to making any bone cuts. So before any surgery is done, we bring the robot in the room, we map out your topography, your anatomy on the knee. We use this software that's incorporated with the robot, and we're able to plan out each of the steps of the procedure and how your knee will be balanced from side to side, front and back, before any bone cuts are made at all, which in the future I believe will lead to better outcomes. So again, I really appreciate you guys' attention. Thank you for paying attention. If you have any questions about the robot, any questions about knee replacement, please come up and talk to me at any time. Thank you.
One of the best things that I talked with Dr. Thomas Nasser is when I started, he told me, hey Joseph, every year I'll take about a year to train and then a year to roll out, but every 2 years I'll learn something and I'll use it in my practice. And every year, it's been 4 years, he's rolled out 3 things that are brand new to the Antelope Valley that don't exist anywhere else except at AVORS. One of them was the Vertiflex, and it was this really interesting implant that goes into your spine that opens up for people who have spinal stenosis. And what's funny was I had a patient who came in the operating room, and when they came to the OR, well, they came in to get checked in, they couldn't stand up straight. So he was at probably a 7th degree, he just couldn't walk. And as he was limping in, he's like, I really hope this procedure works. And after he came out and he was leaving, I'm like, how did it go? And he's standing up straight, he's like, I don't feel any different. So I was like, well, I said, look at your back. And he's like, oh my gosh. So it was one of the funniest moments. I don't want to say his name, I didn't see him here today, but it was really funny because I was like, oh, you don't feel anything different at all? No. And I'm like, well, you're standing straight. That was the first time he's done that in, I think, 2 years. So for him, that was, it was a funny joke, and every time I see him, I always make fun of him. But it was fun. I get to see new services that Dr. Thomas Nasser does every single year, and we're going to have him come up, and he's going to talk about the implants that he does. What's fun about Dr. Nasser is we call him the heart and soul of AVORS because he's got he's got a lot of love on his shoulder. And so one of the comments that I had shown was there's a patient who was in incredible pain, and he came in and said, I'm going to fix you. And he did. And so for her, that meant a lot to have a physician where she said everyone gave up on her, or said they couldn't help her, and he came in and the first thing he said, because he cared about her, was said, I'm going to fix you. So he's going to talk today about implants, and I'll